example, what's the biggest difference from China to United States? I know you've done a lot of research.
Yeah, so I've been doing research on health and healthcare in China since 1979.
Mm-hmm.
And before that, I did research in Taiwan from 1969. So I've had a long time, more than 50 years of research. And the two systems are very different because the two societies are very different. And they're also undergoing very substantial change.
Mm-hmm.
So classically in Chinese society, as you know, the family had the obligation to take care of its members, especially for its elder members, because of the Chinese Confucian virtue of Shao. Shao is filial reverence. It's reverence for those who are older. It's putting the elderly up as the most important part of the family. But that has changed enormously in China over the last 30 years, for example. So that today, there's a bit less investment in filial reverence, and also horizontal relationships between spouses, friends, have become just as important as vertical relations between the younger and the older in a family. And that's changed the reality in Chinese society. The Chinese society today has the government has the commitment that's known as 周世纪三, which means that 90% of people are expected to age at home. 7% are expected to use community services, and 3%, only 3%, are expected to go into nursing homes. So if you go into nursing homes, even high-end nursing homes in Shanghai, Beijing, any of China's major cities, you often find that they're not filled. And that's because lots of elderly people do not want to go into a nursing home. But families have a much greater difficulty at present caring for the elderly. Both husband and wife are working. The grandchild is usually at school. The elderly person is left alone in an apartment at home, and they often feel lonely, isolated, and become depressed. And so that's a reality of China today. Now, with all that said, still the family connections in China are stronger than in the United States. And the commitment of family members to care for sick family members, and particularly elderly ones with dementia, I think is greater. More work is done in that area. But it's not easy. It's become more difficult over time. So I think in the future, we're going to see more elderly go into nursing homes in China. And there's another reason for this, and that is that many Chinese elderly I've spoken to feel more comfortable when they're with people their own age than they do even with their own children, or especially their grandchildren. They don't appreciate the music their grandchildren listens to. They don't watch the same TV programs that their children and grandchildren watch. And they've gone through experiences in their life, the Cultural Revolution, the Great Leap Forward, and the famine associated with it, the political campaigns under radical Maoism, that make their connection to people in their own age cohort very different from the experience of their children and their grandchildren. And so often they want to be with those people who are their own age and they're good friends, but they have trouble. So let me give you an example from my own research. I have a project called Social Technology for Global Aging and Elder Care in China. And this began in Nanjing, a city in the east of China, and is now continuing in both Nanjing and Shanghai, one of China's largest cities. That research, and one of its components, looked at elderly women in high rises in Shanghai who had mobility problems. They couldn't walk very well. They may have had a stroke or Parkinsonism, or maybe they simply had arthritis that kept them from walking very well. And we came up with assistive technologies to help them to walk. And one of them was an exoskeleton for the legs that looked like a thick pair of pants tied to a battery and a motor. And that exoskeleton actually allows a person after a stroke or with Parkinsonism to walk normally. It's quite amazing. But when we showed this to many elderly women in Shanghai, they thought it was a remarkable achievement, but they said they would never use it themselves, which surprised the engineers who developed this. Why wouldn't they use it themselves? Because so chaotic and complex and filled with people and vehicles going in every direction is it to cross a street in Shanghai that these women would never trust any kind of assistive technology to do that. They would want to be in a taxi or a van going somewhere, not walking on their own.
Mm-hmm.
But they did have a request, even though they weren't interested in the assistive technologies. And that request became one of the foci of our research. And that request was they had 5 or 6 friends who they liked very much, but could never get together with because they were all in different high-rise apartments nearby and all had the same mobility problems. So they couldn't get together. And they said, if you can figure out a way that the 5 or 6 of us once a week can get together and go to a tea house and enjoy a couple of hours at a tea house and then come home, that would make all the difference in our lives. Okay. And so that was then our issue. How do you do something like that? Other research along this line is how to care for people who have early dementia when they're still able to do things, to encourage them to be with others, to be in groups, to participate in exercise, and in what the Chinese refer to is yanglao, activities for aging, to nourish people as they age. Okay? And we have also responded to changes that China has made. So with the best of intentions, the government of Shanghai decided that for elderly people living in 5-story buildings, where poor elderly often live, they would put elevators on those buildings. And they put elevators on 1,000 such buildings, and then asked the people to contribute financially to the upkeep of the elevators. But of course, they didn't take an anthropological approach, and this is what we mean by social technology. They didn't ask or think about the fact that an elderly person, difficulty walking on the 5th floor of a building with an elevator, would be perfectly happy to contribute to the upkeep of the elevator. But an elderly person with some difficulty walking on the 1st floor would see no gain whatsoever out of having an elevator. They wouldn't use the elevator, hence they wouldn't want to contribute to it. Mm-hmm. So that's an example of where the technology and the social planning and arrangement has to come together. That's why anthropology, engineering, and the medical field must work closely together. And I could give you many, many examples from the care of people with dementia that would benefit tremendously by having much closer tie across these areas.
So
well, I have 2. The first one is don't be afraid of care. Care is really important. It's what our lives, in my view, are built around. It is what emphasizes our humanity and the importance of our relationships. So care is critical. And actually, it's going out and doing care that you find yourself. The American pop psychology, that you go into yourself and then find who you truly are, and then go out to people is nonsense, okay? The truth is, you find yourself by doing things with and for others, caregiving being an important part of this. And the second message is the importance of a moral movement for care. A moral movement for care. Why? Because our healthcare systems in Canada and the United States are increasingly emphasizing efficiency over care. They're compressing time. They're compressing the time that people are able to work with someone who has dementia or related problem. They're reducing all the kinds of human inputs that occur because they're trying to reduce costs and be more efficient. But that's not what care requires. Care requires human presence, human involvement. And so what we need is a moral movement that emphasizes care as the most important thing that a healthcare system does, more important than efficiency and money making for the hospitals and the insurance companies and the pharmaceutical industry. Care is the issue for families. Families must support it and need to get out there and advocate for it.
Yes, I agree with you. It takes a village to care.